All right, ready? My name is Alexa, and I will be playing the role of the nurse practitioner.
Hi, my name is Meg. I'll be playing the role of the patient, and we'll be covering osteoarthritis of the knee.
Hello, I will be your nurse practitioner today. I would like to gather some information about you and your medical history. Can you give me your age, occupation, and any current or previous medical diagnoses and surgeries?
I have just retired, but I was working as a staff nurse in a hospital my entire life. I take no daily medications, and I do not currently have any medical diagnoses or previous history. I am a very healthy person.
That is great to hear. Can you tell me what your gender, race, and ethnicity is, and if anyone in your immediate family has had any chronic diseases?
I am a female, 73-year-old Caucasian, and my mother suffered from arthritis as she got older, but I don't know much more than that. She was always complaining of aches and pains, especially when she was in her 70s.
Interesting. What is your height and weight?
Well, I guess I should be on a diet. I'm 5'2" and I weigh 170 pounds. My kids are always trying to get me to eat healthier.
Do you smoke?
I quit smoking in my 40s after smoking over 20 years.
That is excellent to hear you quit smoking. Do you try to follow a healthy diet? Can you tell me what you ate for breakfast today?
I guess I should eat better. I know I need to. Today I had coffee with extra cream and sugar. I also had a bacon, egg, and cheese bagel sandwich.
If you would like, I can set you up with our dietitian to help you learn about healthy eating. Do
That
you
would
have
be
allergies?
great. I have no allergies.
Great. Can you tell me what brings you in today?
I've been having some left knee pain that has gotten progressively worse over the last few years. My knee makes cracking sounds a lot, and the pain is always worse when I'm doing exercise. My knee would also cause issues when I'm working long shifts.
Can you tell me when you first noticed this pain? And do you have pain in any other joints?
I do feel stiff at the end of the day. I probably first noticed it in the last few years. Basically, the knees are the worst.
Okay. And typically it's just in your left knee, or is it in your right knee as well? And where exactly in your knee is this pain? Is it sort of localized to one area of your knee?
There's stiffness in both of the knees, but lately it's much worse in the left. The pain feels like it's all over the knee.
So how long has this pain been going on for? Are you in pain right now? And have you had any recent injury to that area?
I did have a fall last year down my stairs. Otherwise, no recent injuries. I am in pain right now. The pain seems to get much worse in the cold weather.
Can you give me a number between 0 and 10 that describes the pain, with 10 being the worst pain you've ever felt in your life? And can you also describe the pain for me? Like, is it burning or aching or stabbing?
It's mostly an aching pain. I would rate it at about a 5. With any type of pressure, the area is almost always tender. Mostly it feels stiff, and I know I'm losing momentum and less flexible than I used to be.
Okay. On average, is your pain typically mild, moderate, or severe? Does it limit your daily activities? And are you having any associated symptoms with this pain, such as swelling?
I have noticed a little bit of swelling, but it's not visible. I would describe the pain as moderate, and it does cause me to not do as much in relation to daily activities. For instance, my grandchildren want to go to Disney World next spring. I just know that all of that walking would be a huge toll on my body and the mid joints. I feel like I'm missing out on spending time with them because I cannot keep up.
Okay. I know that you told me the pain gets worse with activity. Is there anything else that worsens your pain, or any specific activities that aggravate it?
When I'm on my feet for long periods of time, it gets much worse. Also, the cold really aggravates it. It feels like it just stiffens my bones up.
Okay. Have you tried anything to relieve the pain, or has anything that you've tried helped it? Are you taking any medications or non-pharmacological treatments such as heat, ice, or therapy?
I tried Motrin, which helps temporarily. Resting is the best medicine for it. I should ice and apply heat, but I generally just take Motrin and go to sleep when it flares up.
Okay. And what would you like me to do to help relieve this pain?
I'm not sure. I think I would like to get some diagnostic tests to make sure nothing serious is going on.
Sure, I think that is a great plan. After we complete our assessment, I will discuss where we will go from here. First, I would like to visually inspect your knee and compare it to the other. Both of your knees sorry, both of your knees appear symmetrical, and I do not see any bruises, swelling, or other deformities. Are you having any tenderness on palpation?
There is some tenderness when you touch the front and back of my knee.
Interesting. I would like to test the range of motion of your knee. Please extend and flex your knee as best you can and let me know when and if it causes pain.
I am able to flex and extend it, but not as much as I used to. With each movement, the pain gets increasingly worse, and this limits my mobility and flexibility. The pain starts to calm down after a few minutes with rest. I can also hear my knee cracking when I do this.
Okay. After review of your history and current problem, I would like to obtain an x-ray of your knee so that we may determine if you have osteoarthritis. Based off of your symptoms and history, I believe you're experiencing osteoarthritis. Some other things that we may rule out include inflammatory arthritis, or fracture or other type of bone injury, or even a soft tissue injury. Once I obtain results from your x-ray, I will notify you and we can determine if referral to an orthopedic specialist is in your best interest. If you would like, you may use heat and ice for symptom relief, as well as taking over-the-counter Tylenol or ibuprofen until we determine a further treatment plan. Do you have any questions for me?
No, thank you for helping me. I just want to get better.
Great.